someone who's having a stroke where one of the major vessels in their brain, so one of the big vessels that supplies a large area of brain, what we call a large vessel, gets occluded. So a blood clot gets stuck in there and prevents blood flow from getting to that part of the brain. What we actually do is we go inside the vessel from the wrist or the groin into one of the major arteries, and we thread a catheter up to where that blockage is. And as Dr. Zarzar said, we do something called stent retrieval, where we deploy a device that then mechanically pulls the clot out of the brain. And this is something that in the past 5 to 6 years has expanded both in the technology we use, but most importantly in its indication. So 7 years ago, if a patient came to the hospital having a stroke from one of these blocked large vessels, the standard of care was just to give the TPA, the clot busting medication, that would then be distributed through their whole body in the hopes that it might dissolve that clot. But in a clot that large, typically patients were not responding very well. And then there's a series of studies that came out that showed if a patient comes in within 6 hours, you can go up there and pull that clot out and they do better. And then in the past couple of years, we've even had studies that show if a patient shows up within 24 hours, meaning they could go to sleep and wake up with these symptoms and present to the hospital and they have one of these blockages, we can go up there and remove it and completely restore blood flow to that part of the brain. I mean, it's completely redesigned the system because you have patients that 7 years ago, there's really not much we could do. You know, if they showed up at 5 hours late, they're out of the window even to get TPA. You just kind of say, okay, we'll hope for the best and, you know, see if we can transfer you somewhere that might offer this, you know, experimental therapy at this point. We're seeing these patients walk out of the hospital now when 7, 8 years ago, it was more or less a, you know, a devastating outcome.